Hi, I'm Dr. Melisa Holmes. I'm an alum of the Lambda Sigma chapter at the University of Georgia. I'm an OBGYN and the founder of Girlology. National Women's Health Week is about helping women of all ages take manageable steps towards better health. Obviously, each woman's health journey will look different, but there are some overriding health practices that are important for everyone, like nutrition, exercise, sleep, safety, mental health. But I'd like to go beyond those essentials and focus on the importance of you being a true advocate for your own health, especially as you partner with your healthcare provider. As a physician for girls and women, I see way too many women who aren't getting the best care they can, and I want to help change that for you. So I have 6 tips that I find myself saying to my patients almost daily, and often to my own daughters and friends, to help them take a more active role in their own health. So, number 1, know your health history and keep it documented on your phone or somewhere accessible. In medicine, we call it your past medical history, but for you, it's your health story. The more you can communicate about your personal health and your family's health, the better your doctor will understand your health, whether she's treating an illness or building a strategy to prevent future health problems. So what should be a part of your story? I can provide a detailed list in the blog, but basically, vaccinations, any significant medical illnesses, hospitalizations, surgeries, and the details about those, a list of current medications, including your doses, a list of past medications and how you responded to them, your allergies, and a big one, your family medical history, which provides insight into what you should be focused on for prevention. That's going to include any significant health conditions that members of your immediate family, including siblings, parents, and grandparents, have experienced, specifically heart disease, diabetes, cancers, other chronic conditions. I know that sounds like a lot, but during this time of sheltering, when life is a little slower than usual, it's a perfect time to do the research and write it down. Talk with your family members and get the details. This is your personal health data, and it allows your doctor to provide better care for you. Plus, when you can hand over a list of those details, you can save a lot of time that you would spend that you might have lost in the office talking about your future health. All right, tip number 2. Track your periods along with any other symptoms that concern you. No matter how old you are, if you've had or should have periods, your doctor should be asking for details. In women's health, we consider the period a vital sign, an important indicator of your health. So if you have periods, track them. It doesn't matter if you're avoiding pregnancy, using birth control, trying to conceive, or heading towards menopause and beyond. This is important health data too. Granted, there are some types of birth control that can stop periods, and that's perfectly safe. But if you're not on birth control, the pattern, flow, and symptoms related to your periods provide really important insight to your health. Because irregularities in the timing or flow can indicate things like thyroid problems, nutritional issues, infections, tumors, the status of your hormones. And similarly, we're learning more and more about how the hormonal changes of the menstrual cycle impact health in a lot of ways, including our weight, nutrition, mental health, energy levels, skin, digestion, autoimmune disorders, migraines, even your risk for injuries. So if you track your periods along with any symptoms that concern you, you'll gain awareness and insight that can help your doctor make a more accurate diagnosis and possibly get you faster treatment or relief. There are plenty of tracking apps out there also. So my favorites are Clue, Flow, and Spot On, which is particularly good if you're using contraception. Number 3, make your annual visit your birthday gift to yourself. When we're feeling well, seeing a doctor isn't always a priority, but well women checkups are important for so many reasons. Women are disproportionately affected by certain health conditions that create the greatest burden for us. And so this is your opportunity to have your provider screen for those conditions and help you reduce your risk for them or diagnose them early when they're a lot more treatable. So what conditions are we talking about? Some vary by age, but in general, every year, your doctor should be considering your risk for sexually transmitted infections, pregnancy, depression, cancer, diabetes, osteoporosis, relationship violence. If you only go to the doctor when you're sick, these things are easily missed. So don't skip your pap smears, your STI testing, mammograms, colonoscopy, bone density, depression surveys, blood work, and vaccinations. These things truly do save lives. And the best way to remember when it's time for your annual visit? Schedule it during your birthday month, and you'll be giving yourself a great gift of better health. Tip number 4, there is no place for taboo and embarrassment about our bodies. If you grew up in a culture at home or school or your community where conversations about bodies and how they work were uncomfortable, it probably made you believe that there was something embarrassing or shameful about it. When things like our bodies or menstruation feel taboo, it's normal to feel silenced. And that can make us avoid asking questions or convince ourselves that something's wrong when it may be totally normal, or wait too long to seek help. So please don't be embarrassed to talk with your doctor about things that might feel awkward. I see too many women who have let embarrassment keep them from getting help, especially related to concerns about their anatomy, sex, menstruation, leaking urine, mental health, digestive problems, or violence. As doctors, we address these issues every day, and we're here to help, not judge. But I will finish this tip by also saying that if your doctor ever makes you feel judged or embarrassed about your body or behaviors, it's probably time for a new doctor. There are lots of great ones out there. Tip 5, don't minimize your symptoms. As women, along with feeling silenced, many of us have been conditioned to minimize our symptoms, to suck it up and get on with things. As a patient, sometimes we get nervous in the exam room and we downplay our symptoms, or we feel like we're rushed and we don't speak up. That does you no good. So don't make your symptoms sound like they're tolerable when they're not. Don't believe your symptoms aren't bad enough to get help. As a gynecologist, this is particularly relevant when it comes to your periods. Mild cramps may be common, but cramps that stop you from doing things are not normal. Heavy bleeding or a little spotting are problems that need an evaluation. And feeling paralyzing anxiety around your periods is not just PMS, it needs treatment. When women minimize their symptoms, it delays the diagnosis and the treatment of serious conditions like endometriosis, premenstrual dysphoric disorder, autoimmune diseases, urinary incontinence, anxiety, depression. Being honest about how your symptoms affect your life can truly be life-altering. And finally, tip 6, my final tip is short and simple. You are the expert on you. Your doctor is an expert in their specialty, but nobody knows your body symptoms as well as you do. You're the only expert on you. So pay attention to your body. Trust what it's telling you. Know your history. Think about what you want for your future and be an advocate for your own health. I hope you find these tips helpful as you progress on your own health journey. And if I can ever help you out, you can reach me through Girlology. Thanks so much.